Good evening. The police are seeking the public's assistance to locate 68-year-old PINKSON Hanniford of Burroughs Avenue in Kingston 20, who has been reported missing since yesterday, January 17. He is of brown complexion, slim build, and is approximately 6 feet 5 inches tall. Reports from the Duhaney Park Police coming into our news center are that Hanniford was last seen at home and has not been heard from since. At the time he went missing, he was reportedly wearing a yellow t-shirt and a pair of black pants. Anyone knowing the whereabouts of PINKSON Hanniford is being asked to contact the Duhaney Park Police at 876-933-4280, Police Emergency 119, or the nearest police station. Still tonight, the public is being advised that the Joint Commanders for the recently declared Zones of Special Operations in sections of SAVANNA-LA-MAR, Westmoreland will be imposing nightly curfews under the ZOSO. The curfews will commence at 6 p.m. and will remain in effect until 5 a.m. the following day. Movements will be restricted to essential workers and other individuals with emergency situations and legitimate reasons to be on the streets. Each situation will be assessed and, where necessary, the approval will be granted by the ground commander. All businesses operating in the area will remain closed during the period of the curfew. Now, in order to minimize delays at checkpoints, persons are being encouraged to take with them an official form of identification such as passport, driver's license, or national ID, and for essential workers, their work identification cards. In other news tonight, the police say they are reaping success in sections of the SAVANNA-LA-MAR South area of the parish that is currently on its second day of the Zone of Special Operations, ZOSO. More than 20 persons of interest have been taken in for questioning and 4 arrests have been made. Yesterday, the officer in charge of the Westmoreland Police Division, Senior Superintendent Robert Gordon, reported that multiple operations were conducted by the security forces that day, including stop and search as well as targeted and snap raids. During these operations, 2 individuals were arrested, 6 persons of interest taken in for processing and questioning, 5 motorcycles seized, more than 40 tickets issued, and an undisclosed amount of marijuana confiscated. On Sunday, the first day of the security forces operations, more than 20 individuals were taken in for questioning, 2 arrests made, and over 50 pounds of marijuana seized. No weapons have been recovered to date. Now, the parish had a bloody start to the new year, recording 9 murders in comparison to 2 for the corresponding period in the previous year. Continuing with the news, Custos of Westmoreland, Honorable the Very Reverend Canon Hartley Perrin, has expressed support for the Zone of Special Operations ZOSO declared in southern SAVANNA-LA-MAR in Westmoreland. He noted that it will help to curtail the escalating crime and violence in the parish. Prime Minister Andrew Holness, during a virtual press conference on Sunday, had announced the imposition of the ZOSOs in the communities of Russia, Darling Street, and Dexter Street for a duration of 60 days. Now, in making the declaration, the Prime Minister said the security measure is necessary to address rampant criminality, save lives, and protect communities. Speaking this week, Custos Perrin said he is hopeful the ZOSO will help to rein in perpetrators of crime in the parish. The Custos added that he would welcome its rollout in other communities in the parish that have also been experiencing an upsurgence in murders. He argued that additional social intervention measures need to be engineered for unattached youth in the parish, which he believes will also help to combat crime. Still making Mello TV news, 15 Jamaicans are the latest fatalities as a result of the COVID-19 virus, as the country reported 1,548 new cases of the virus in the last 24 hours. This has now increased the death toll from the virus since the start of the pandemic to 2,551, and the total of cases now to 114,986. The latest victims include 5 males aged 46, 75, 85, 92, and 96, as well as 5 females aged 39, 52, 75, 80, and 87 from St. Catherine. 3 males aged 69, 74, and 75, along with a 39-year-old female from Kingston and St. Andrew, and a 77-year-old male from St. Thomas were also among the latest fatalities. Now, of the newly reported cases, there were 971 females and 577 males, ranging in age from 15 days to 97 years. The cases were recorded in Kingston and St. Andrew with 545 cases. St. Catherine recorded 262 cases. St. James recorded 143 cases. St. Anne 102. Westmoreland 81 cases. St. Elizabeth recorded 75 cases, while Manchester recorded 72 cases. Clarendon 62. St. Thomas 56. Trelawney 50. Hanover recorded 42 cases, while Portland recorded 39 cases, and St. Mary recorded 20 cases. In the meantime, the country also recorded 209 additional recoveries, increasing the total of recovered persons now to 67,481, while there are 15,329 confirmed active cases. Continuing with the news tonight, effective tomorrow, January 19, Jamaica's public hospitals will be restricted to conducting emergency care services only. Now, this comes as several of the island's public hospitals face increased pressure due to the growing number of confirmed and suspected COVID-19 cases. There is also decreased staff coverage as many healthcare workers are out sick. Up to Sunday, there were 682 persons in hospital isolation for COVID-19. Of that number, 486 were positive, as well as 196 suspected cases. Minister of Health and Wellness, Dr. Christopher Tufton, said, quote, "All our hospitals are seeing increased numbers, and several of the larger hospitals are over 90% capacity, with some over 100%. At the same time, there is an increase in admissions for other illnesses. As a result, all public hospitals are operating on emergencies only." End quote. The minister added that persons should exercise discretion in going to the hospital at this time. Elective cases are being postponed. Members of the public will be advised as to the new dates for these procedures. The Ministry of Health and Wellness continues to encourage all persons to get vaccinated. It is critical that all persons also wear masks, wash hands frequently, and exercise the 6 feet physical distance rule. Members of the public are also being encouraged to avoid gatherings and stay home if you are ill. As we continue to monitor the impact of COVID-19 across the island, the Southeast Regional Health Authority, SARA, has frozen all leave applications and have directed healthcare workers on non-essential leave to return to work. This as its facilities buckle under the weight of the 4th wave of the novel coronavirus pandemic. The directive issued by SARA says that the regional director, Errol Green, has directed with immediate effect that if the need exists, all staff members currently off on non-inescapable or non-essential leave must return. Approval of non-inescapable leave must cease until further notice, and only urgent or emergency surgical procedures be addressed until further notice. Mr. Green, who spoke to our news center, outlined the new measures being used to deal with the rapid increase in COVID-19 cases and hospitalizations.
We have scaled back on our services. We would have called back all those persons who are on leave that we deem important due to the exigencies of the service. We would have frozen all leave going forward, and we would have scaled back on our services as well in primary care. What this means is that those persons who have scheduled to come to clinic and they are not urgent. We're asking them to reschedule these appointments. For those persons who have appointments clinic that is not critical, we would have asked them to reschedule these appointments. And we monitor the situation from day to day. We also have to scale back on our vaccination exercise. We do have fixed sites that we operate, but we unfortunately cannot carry out the numbers that we would have wanted to, but we have scaled back a little bit on that as well.
SARA comprises 92 health centers and 9 major hospitals, including the Bustamante Hospital for Children, Sir John Golding Rehabilitation Center, Hope Institute, National Chest Hospital, Spanish Town Hospital, Linstead Hospital, Princess Margaret Hospital, St. Joseph's Hospital, and the Kingston Public and Victoria Jubilee Hospitals. In other news, the Black River Hospital, BRH, in St. Elizabeth has benefited from donations aimed at improving health care in rural Jamaica. Recently, the hospital received 2 phototherapy lamps for its pediatric unit from District Grand Lodge of Mark Master Masons of Jamaica and the Cayman Islands, and 2 bariatric wheelchairs for plus-sized patients from the We Care Social Outreach Development Limited. Consultant pediatrician for the BRH, Dr. Agri Sajabi, thanked the District Grand Lodge of Mark Master Masons for donating the costly phototherapy lamps, which are used to treat severe jaundice in babies. Turning to the donation of the bariatric wheelchairs, CEO of the hospital, Diana Brown Miller, explained that the wheelchairs that the hospital use are of a standard size. However, when patients of a different size are to be transported, it presents challenges because of the absence of the specific type of wheelchair needed. Still making Mello TV news, the Jamaica Constabulary Force JCF is warning the public to be on the alert for criminals who target potential car buyers with promises of good deals on motor vehicles with the intention of swindling them out of their money. The police said that they are aware that persons are using the image and name of Government Minister and Member of Parliament Daryl Vaz to lure unsuspecting persons into purchasing motor vehicles. These persons are in no way connected to Vaz and do not have the authority to conduct business on his behalf. In a similar incident last year, 35-year-old Sean Latham, a merchandiser of Knightsdale Drive, Kingston 19, was charged with obtaining money by false pretense and fraudulent conversion. He is scheduled to reappear before the court in February. The public is being urged to be wary of these unscrupulous persons and should always seek to do these transactions through reputable businesses and official channels. The police are further advising citizens to take extreme caution and exercise vigilance before conducting these business transactions. Persons are encouraged to immediately report any such incidents or to contact the nearest police station or emergency number 119. Continuing with the news tonight, the Consumers Affairs Commission is advising that customers should be vigilant when shopping online. Addressing a think tank session recently, Information Technology Manager at the CAC, Andrew Evelyn, said there are criminal actors currently on the internet trying to extract money, and the Commission wants to ensure that consumers are protected and practice safe internet usage. The #1 tip for shopping online, according to Evelyn, is using familiar websites. He warned against unscrupulous online vendors who do not necessarily take the consumer's interests into consideration but instead are highly profit-driven. Additionally, he said misleading social media advertisements are a major shopping scam, and so consumers should carefully check advertisements that they come across. And that's our news package for you tonight. Thank you for tuning in to Mello TV Evening News at 8. I am Shelley Ann Hill. Do stay safe and pleasant viewing.